like to introduce our co-moderator for this, Dena Evans. And she was the women's head coach for Team USATF at the 2023 World Athletic Championships in Budapest. And she's been a long-time coach, coaching distance runners for 25 years. She must have started when she was like 4.5. And is currently the club director of the Peninsula Distance Club. So we'll hear from you a little bit, and then we'll take some questions from our audience.
Okay, awesome. Thanks, Nicole. Yeah, so so lovely to be here in front of this group. Some of you I've coached. Some of you, Coach Clark is here. He was coaching when I was in college. Dr. Fredrickson, he was my doctor, my team doctor when I was in school here. Tomo was on staff when I was coaching here. But yes, spent several years here as an athlete on the soccer and track teams, and then on the coaching staff for the track and cross country teams. And but in the 26 years since I started coaching, I also had 2 children who have been and are currently collegiate soccer players. So from my perspective right now, as I fly tonight to go to the ACC championships, I'm thinking of this as like a soccer mom. And some of you know me in that context. But of course, many of the issues of this conference kind of hit on that's that sport as well. So I'm looking at this from both perspectives. And so as such, I think I'm here to kind of be a little bit of a fly in the ointment and ask some questions about being in the, in the field, as it were, on the track. And so the questions I have about all of this wonderful research, which is so much, been so great compared to, say, what we were dealing with, 30 years ago or whatever, is so I'm concerned with how do we apply these findings in contexts where, for instance, our soccer team that's going to play in the ACC championships tomorrow, they can't change that date. If we're dealing with these fluctuations, how do we optimize for fixed dates? And, in the context of dealing with groups, whether it's individual sports like running, where you can vary a little bit, but you try to maximize for the group, or whether it's, very much team sports like basketball and soccer, how do you try to find common threads through this to allow for the participation amongst groups, which of course could maybe enhance the performance at a greater percentage than maybe you might find by optimizing for just this variable.
So maybe if you're about to ovulate, you're benched because you're already working so hard.
Well, I think the coaches
depending on the timing,
would have a hard time with that as a general prescription.
Sounds like that's the question.
Yeah.
Well, I think what you're speaking to is cycle syncing, right? And a little bit, and maybe not just cycle syncing, but finding out for you individually if you're having various symptoms or raised heart rate or sleep issues or whatever, how do you manage that as an athlete? And I think from a research perspective, everything that we know about cycle syncing suggests that there isn't enough information to give conclusive evidence about you should train a certain way in this phase, or you're more at risk for injury at this phase, or you're going to sleep worse no matter what at this phase. I think we're still in the preliminary phases of understanding that, but I think it's so individual, as you pointed out earlier. The way your period affects you is such a personal thing and impacts people so differently. So for me, I think it's talking to your athletes about how does it affect them, what are their hurdles and their barriers personally, and trying to address it more on an individual basis to help them overcome whatever challenges they have, than trying to come at it from a blanket approach at this point in time.
For sure. I'll just add one thing that it was interesting, I think, in looking at sleep across those different weeks of the menstrual cycle. Like, the take-home message there was actually that no matter when you decrease your sleep, you have an increase in your resting heart rate, and sort of the similar magnitude. So I would say, like, there's a lot more to dig into, like you said, Kristy, but we don't really have conclusive evidence to dictate or recommend on a population level. Maybe for an individual, if you're coaching them, if they're monitoring the trends, like I have heard from people that managing their symptoms, for example, is helpful for their performance, or they feel it's helpful for their performance. But
yeah, to add to that, I didn't mention it in my talk, but I also collected perception data. And firstly, people who perceived that they had a worse menstrual cycle had slightly more fluctuations in their biometrics. But actually what was more significant was the perception between different types of contraception. So in a soccer cohort, for example, I'm imagining there's less of a REDS risk than maybe in an endurance cohort. And if you have someone who is really struggling, maybe looking at hormonal contraception is more of a sensible solution. In terms of if it's just going to make your athlete feel better, we've heard about mindset. Maybe that is a way to address the performance, as long as that's not going to increase their injury risk. And then additionally, I think there are factors that you can change, such as the fatigue, making sure, not changing your training as such, but just making sure you really try to reduce your fatigue when you're maybe more at risk or feeling worse. And I think that's the best way to manage it, rather than try and do any adaptation in your key training sessions. And doing what makes an athlete feel better. And I think that's kind of why I want to make informed choices, because maybe there is a better choice for an athlete out there, but you just want to know all the pros and cons of those choices before you go and say, I think you should do this.
So kind of optimizing for the 22 hours outside of training, or 21 hours.
Absolutely. Well, and periods affect sleep, right? So how many girls and women are waking up changing their pads in their bed and their sheets, or they wake up with cramps and pain? So I think these things can be dualities for some people. So that's also factors in.
I got another question. So I feel like a lot of the conversation around this is trying to mitigate risk for REDS, as you mentioned, or just injuries generally, or just all sorts of things. How can we flip this conversation towards talking about optimizing for performance, And I would love to see, and you all are on the way, obviously, but let's have the conversation about how do we become menstrual cycle as part of the superpower of women, and towards optimal performance, and it's an easy one. Go.
I don't know.
You want to start?
Visualize.
Yeah, I think that's something we do want to look at with my data. It's kind of hard and that is actually why we collected the performance data alongside, because we wanted to see, so we have a side project looking at reducing injury, but obviously one way to reduce injury is just not to do anything. So we actually have another study where we're trying to look at how you can maximize your performance while not minimizing your injury, but reducing the injury risk, and that trade-off. And we also saw in our data that increasing your volume was associated with, your training volume was associated with better performance, but it wasn't actually associated with losing your menstrual cycle, which really shows us that you can be a better athlete and train more as long as all those other factors are in place to support you. And so it is possible. You can train 100 kilometers per week and still have a regular cycle. I have that in my data, and they are performing well. The people who trained more did perform well. So I think that's a question we are trying to look at as well. Just didn't really mention today. Yeah.
Well, it looks like we have a lot of questions.
Go for it.
Yeah.
Sarah, that was a great plug for the nutrition session coming up. So fantastic talks. I actually don't know who this is targeted to, but I'm going to throw it out and see who picks it up. Do you feel that there is a life stage regularity or irregularity? We talk a lot about adolescence, first 2 years of menstrual cycle being a little bit more irregular until maybe after that second year. And I'm just curious if there is any evidence as far as puberty versus 20s versus 30s, and then of course into perimenopause, if we're seeing more regularity as athletes or individuals gain birthdays, and if there is more stability within those menstrual cycles and different hormonal phases, whether it's in athletes or non-athletes, or in any of the research that you're seeing.
I think that might be me.
The only.
I mean, I think we don't have the data in athletes versus non-athletes, but we certainly see hormonal stability grow after puberty, maybe not even 2 years. Many people are actually accomplished at 1 year, but by the time they say go to see your doctor, they say hang in there for 2 years, but that's not necessarily the case. It shouldn't be that people aren't having periods for 3 or 4 months when you start. But then we kind of see puberty go in reverse, right? So you're now in your perimenopausal years, and now your periods are spacing out or more often or irregular. So I think that's when we're seeing that kind of polar changes in the hormones. But I think you're seeing the hormone regularity and the cycle regularity improve over time. But the question you're asking, is that different for athletes?
Yeah.
And I don't know.
Yeah. It just kind of makes me wonder if we approach it and react to it differently during these different stages, whether a coach or a clinician or the athlete themselves, and how we can better inform them.
And I think it factors into, how you feel about your body, what is your nutrition, and what does your doctor say to you, and what does your friends say to you, and
Right.
and what is your coach? So, I think we see so many, when we talk about individualizing, I think each person's experience with their various encounters about their periods is so different. Because there are a lot of people who love their periods, like, I'm a woman, this is great, look at me, I'm cleansed, and, they have this whole, woman power
Aura,
about their
yeah.
period. And then there's other who like, this is death, get rid of it, get it out, when can you do my hysterectomy? And it's so individual, and you can't cluster it into one type of person or one sports, or it's very individual and unique, and it's fascinating, actually.
Absolutely.
I think we do see in our military data too, Emily, the older women were, and we didn't have the power because there weren't enough people who did ovulate. The ovulatory group that I was able to show, they were older and further post-menarche than the other group. So that there did seem to be a hint towards more resiliency in terms of the military environment anyway, and that we weren't able to really discuss it too much because of the limited power, but we did see that.
Thank you.
I would say, look, when this is obviously outside of the lab in the world that I live in, but the way that I handle or deal with a lot of these conversations is starting with what's normal for you when you're feeling, when things are going great and you're performing well, like what's your normal? And of course, you just have a better track record of understanding what that is, I think.
That's a great
older. So people can look back and say, this is my typical pattern, and then we can kind of identify, at least that's.
Back with another question from a previous session. In 2019, the US women's soccer team actually partially attributed their championship win to what we would now call cycle syncing or tracking their period. Fast forward to 2023 and Dana, into your coaching world, noting the limited kind of or emerging research, have you been able to take something tangible into your world into 2023 and possibly there beyond, something tangible that you could qualify or probably disqualify?
Well, I think in track and field, you have the unique situation where a lot of the folks at the very top level are able to really fine tune for their own individual needs. So that's something that's a little bit unique. Of course, Dr. Yates is talking about her training environment, where it was very much a team thing. I don't see nearly as much of it as I'd like to see. But again, I think for what I observe is there's lots of great research out there, but it's really hard to take, dealing with hard and fast deadlines and dates. It's really hard. I've heard a lot about that, the 2019 team and some of those things. And I've heard a lot about that, but I still don't know if I completely understand what actually went on there and how that
I think I could speak to that a little bit because they were working with a company that I was also consulting with at that point. But that article was taken a bit out of context. They were working very individually with those athletes to help them manage their individual cycle symptoms, and it wasn't the cycle syncing that we think about when it's a whole team doing this one thing. But they were having very individualized work around their menstrual cycles on that team. So I think it was taken a bit out of context in that media.
So that would definitely support that an individual approach, even in a team setting, could very much, again, flipping the script to preventative, but could very much optimize each specific player in the team to then produce a different result. Or again, do we just not have the
their
data?
Perception of it. They might be perceiving, I don't know if they have the data to say it improved their performance or it did this or did that, but they certainly felt it was helpful, and that might be half the battle. I don't know.
I would balance that against, say, like in distance running, going to altitude. Say you could, try to achieve maybe a 3-4% performance benefit from going to altitude, but maybe you're miserable because you're lonely and you're away from your normal routine, or maybe you have a higher chance of injury for a variety of different reasons. Is that better than doing this? Or, I think that's the challenge is factoring in each of these different variables that could give you 2 to 3%, but would maybe take away 2 to 3% because without the other, they don't work together.
Thank you.
We'll take these last 2 questions.
Thank you. First of all, thank you for this very nice and important discussion. So I have a question for Hannah. You showed these nice rhythms in the biometrics data, like the heart rate, synchronized to the different phase of the cycle. I was wondering if you look at women that are not having a cycle at all, or do you still see patterns, or is it completely gone?
It's a great question, and definitely something we haven't touched on fully, looking at sort of irregular cycling. The part of the issue is that we're relying on self-report, or I should say challenge, is that we're relying on self-report. So we also don't know if people are not cycling versus just not reporting. And so that's sort of made it difficult, but we do see some different patterns, and we're able to actually sort of detect when someone actually, or we think when somebody is cycling and just didn't report versus, did, just based on the patterns alone. And I think there were a few hundred people or a small subset of people in the data set who actually were on hormonal contraception, and the patterns look different too. So I think there's still a lot to discover and explore there. Yeah.
Thank you.
Thanks, Nancy Williams, Penn State. A question, a couple comments. With the wearable data, that was really cool to see those cycles. It seemed like you had a lot of people. It's a lot of data to see that rhythm. I wondered if you were able to analyze repeated cycles in the same person, because after all of this, we're trying to apply all this, and that's when the individual is really what matters, what is different within a person. So are people repeatable with those cycles within themselves?
I would say fairly repeatable, but it is the individual variability was greater than the sort of between person variable, so within a person. And there's, I think a lot to explore there, but thanks.
On the issue of maturity, I think it's a great topic. I think there's a known effect of gynecological age on the susceptibility to energy deficiency. So older women will not be perturbed. We've done studies where women are 25 to 35 losing the same amount of weight as younger college-age women, and it was very hard to perturb their cycle. So I think a little bit of that is out there. And my last comment is, with respect to hormonal contraception, I think we need to be aware of possible impacts on bone health. There's a lot to be said about a lot we don't know about hormonal contraceptives, effects on metabolism, and the susceptibility to changes in performance and all of that, but the bone health issue is really important, and the oral contraceptives can have negative effects on IGF-1 and on bone. And newer data suggests that the route of administration is important, so a patch providing estradiol can really help rescue that decline in IGF-1. Thank you.
Thank you. Well, I'm supposed to encourage everyone to take a break and get some nutrition and fueling.